Welcome to this evening's program, Serving Communities, Florida Health in Hillsborough County. My name is Chris. I work with Tampa-Hillsborough County Public Library, and I'm joined this evening by Jennifer Waskovich with Florida Health in Hillsborough. And before she gets started, I am just going to go over a couple things here. This program is part of our Libraries Build Communities Partnership. This is a collaboration with USF's School of Information's Responsive Librarianship Group. And since February, we've been partnering with them to provide programs to families in need. The themes have been ranging by month, but we have 2 book clubs and 2 information sessions every month. And to learn more about all of that, you can go to hcplc.org/librariesbuildcommunities. Also, we have a book shout out tonight. It's the Mayo Clinic Family Health Book. It's the 5th edition. It's available as an ebook through our Hoopla collection. And with Hoopla, you don't have to wait. It's available immediately. And to find out more about other ebooks that we offer, you can go to hcplc.org/ebooks. All right, I am now going to stop talking, and I'm going to officially introduce Jennifer Waskovich. She is the Health Promotion Program Manager for Florida Department of Health in Hillsborough County. We'd like to welcome you, Jennifer. How are you this evening?
I'm doing well, Chris. Thank you so much for having me. Well, good evening, everybody. As Chris said, my name is Jennifer Waskovich. I am with the Florida Department of Health, and I oversee a number of our health promotion and education programs. Tonight, I'm going to talk to you about some of the programs I oversee, but also some of the other programs that our health department offers for the community. And at the end, if you have any questions, Chris will pass those questions on to me. I'll get the answers to the best of my ability. I'm not an expert on every single program, but I do have a pretty good understanding of what our health department offers for everybody. I'm going to start off with our health promotion programs, mainly because these are the ones that I am more familiar with. These are all of the ones that I oversee at the health department. So in health promotion, our goal is to be out in the community and really help educate people and provide some services to reduce chronic diseases and other diseases as they age. The first one I'll talk about is diabetes. We offer a diabetes prevention program and a diabetes management program. And these programs, as they sound like, are geared towards preventing diabetes in our diabetes prevention program. And that's a year-long, commitment. It's free of charge. We don't charge for any of these chronic disease programs. And the goal is to help individuals lose weight while providing some education and tips for behavior modification, eating tips, physical activity tips. And the reason why it's a year long, it was designed by the CDC, and it's shown to really reduce the risk of diabetes for people as they age. So that is one of our main programs. And our diabetes management program, that's for individuals who have already been diagnosed with diabetes. It's a 6-week-long program, and each week it covers a different topic. So it could be nutrition, it could be medication and how to work with your medications, blood sugar checking, coping mechanisms, because sometimes when you're diagnosed with a chronic disease, it can be very stressful. So how do you handle that as you're trying to manage your disease? And again, that is no cost, and it is offered, provided by registered and licensed dietitians. We offer all of these programs in English and Spanish. Our next program is our blood pressure management education program. That's a 4-week program where we just help teach individuals how to eat, be active, how to check your blood pressure. It could be for those individuals who are already diagnosed with high blood pressure, or maybe those who are at risk, who are trying to prevent themselves from becoming hypertensive in the future. Then the third category of program we have is our weight management and healthy eating program. It's called Get Into Fitness Today. And you can actually we have a website, getintofitnesstoday.net. And this is a 12-week program where our facilitators kind of lead a support group. So those in the group, we educate, but we also encourage people to share their own ideas. We've had people who have had great cooking tips or kind of like food demos where people will bring in food and have shared it with the other class participants. And really just the support helps people lose weight. And that's kind of what we're focusing on here, is increasing your physical activity to lose weight and also increase the number of times you're eating fruits and vegetables during the week. And there's a lot, it touches on a lot of different things like salt consumption, trying to eat lower fat, and different dietary things you can do to help eat better as we age. All right, let's go on to our next one. We have a breast and cervical cancer early detection program. So with this program, it's geared more for women 50 to like 64 years of age, those who are uninsured or underinsured. If you have insurance that doesn't cover your annual mammograms or pap smears, this program can assist you. And we contract with different physicians and providers throughout the county for mammogram screenings and, like I said, cervical screenings. And then for those who don't have insurance, we cover the cost of that if you qualify. And I know there are items, handouts that I have that you should all have access to in the handout section. And all of these programs are listed on there with a phone number, so you know who to call. The next, our lead poisoning prevention program. We have a specialist who focuses on the age of 6 and under for lead poisoning prevention. We also will work with adults, and anybody who is tested for lead, the results are reported to the state of Florida, and then we get those results. So I have an environmental specialist who daily is checking these, and we reach out to those families who have a high lead level and talk about some tips on how we can reduce that lead in your environment, try to figure out where the lead poisoning may be coming from, talk a little bit about nutrition and prevention tips that way. And at times we also go out to the houses to check if there is lead in the environment. And then health promotion presentations. So if any of you work for organizations or have church groups or other community groups where you are looking for some health promotion, maybe topics, you can reach out to us, and we have some already designed, or we can look at putting something together tailored to what your needs are on some of these chronic disease and health topics. All right. So next I'll get into some of our clinical services. We do have locations throughout the county. Family planning, we have dental, HIV care, we have an STD clinic, and we have a pharmacy. Now our pharmacy, I'm hoping you guys can all see that because my screen seems to be loading a little bit slow. But all of these programs, some may have a sliding fee, scale fee, but most, if you have insurances, will cover some of these. And then we also have the Ryan White grant. So we assist people if they need help with their HIV medication through our AIDS Drug Assistance Program. And again, these phone numbers are all in that flyer that you guys have access to. Our pharmacy also helps those individuals who are going through our HIV, STD, or tuberculosis clinics. Our dental program we have for those with HIV, or we partner with some other organizations, mainly like Suncoast Health Centers, to work with the schools for the dental sealant program. All right, hopefully that's all loading for you guys.
It looks fine, Jennifer.
Does it? Okay, yeah, mine, it's looking kind of distorted on my screen. Okay, as long as it's fine. All right, and then we have an immunization clinic. We have one location in the county, and they promote immunizations across the lifespan. So for children, those mandatory vaccines to get into schools, and also for adults, I know we have some, a lot of people in the county who are looking at traveling abroad at times. So they reach out to us to see, for vaccines that you may need if you're traveling abroad for some of those higher risk diseases. Children, we do take on walk-in basis. For adults, you do need to call to set up an appointment and to make sure that we do offer that vaccine. I have a website on here that you can go to, thepowertoprotect.org, and it just has some information on there about what vaccines you need at different stages in your life. You know, as a child, in middle age, and then as we all get older in the elderly population, there are some that are recommended. All right, and then one of our other disease control programs, we have a refugee program. And this program conducts health assessments and immunizations for asylees, refugees, and other groups who have come into the country, including some victims of human trafficking. So they do the health assessments, they help with referrals to social programs that any of these individuals may need. And then they just kind of continue making sure that they've had all their lab work and other health things that they need. They also refer to some of our other programs like our lead poisoning prevention program and some of our health education programs like diabetes. So if anybody's coming into the country who are already at risk for some of these individuals, they'll put them in contact with other community programs to help them out. And then one of the programs that many people have heard of is our WIC program. It's Women, Infants, and Children. And this is a nutrition education program where you have health educators, nutrition educators, breastfeeding specialists, and dietitians who are there to provide nutrition support and assessments for children up to their 5th birthday. They also work with prenatal, like pregnant women, and women who are breastfeeding and postpartum. So the purpose is to provide the nutrition education, determine what diets and what foods are most appropriate, and then they provide EBT cards with healthy foods that individuals can purchase at multiple stores throughout the county. And the foods, it's not just like a food stamp program where you can buy any foods. The foods that are on here have certain nutrients that are shown to help with childhood development. So iron, calcium, protein, things that individuals really need for growth as a young child, and nutrition that women need while they're breastfeeding or while they're pregnant. So that is why there are certain foods on there. They also provide artificial baby milk, like formula as most people call it, for medical needs. They have basic formulas, but then there are also these artificial baby milk for maybe children who have certain health concerns where they have allergies or they can't digest stuff properly. You can work with the WIC program if you qualify. It is income-based, and there are 7 locations around the county. So they do have them spread out throughout Hillsborough to make it easier for people to access. And then another program we offer is our Vital Statistics Office. And this is where birth certificates and death certificates are available. So anytime, you know, someone has a baby, this is where the birth certificates come from. And we have a location, it's our university location up a little bit north of Fletcher on 22nd Street. You don't need appointments, it's a walk-in service, but they're also online. You can order birth certificates. Vital Check is the site that they recommend. And you can purchase these online. You can purchase multiple copies. The first copy of the birth certificate is $14, and then any additional ones on that order are $9. Death certificates, $10 for the first one, and then a little bit less for those. And they also have protective plastic sleeves if you want to keep them protected throughout time. Payment-wise, they do accept cash, cashier's checks, money order, credit cards, with MasterCard or Visa logos only. Okay, and like I said, the university office, you can walk in and get those. You don't have to have an appointment ahead for the birth certificates. If you are going into the office to pick these up, you do need to have valid identification. So it could be driver's license, state-issued ID, passport, or military ID. It is required. They won't issue one without that. And they can assist you if you don't have one of those other 4 types of IDs. They'll work with you to see what can be used. All right. after vital statistics, we have our health preparedness program. So their main job is to provide education and information on how to prepare for a disaster. It could be man-made, natural. A lot of people think of us for hurricane preparedness, but they also do things when there's political conventions in town, Super Bowl, anything like that. They're working with the community to make sure we have things in place to prevent any emergencies that may happen. We also provide training to partners in healthcare systems on how to respond during emergencies. So hospitals, school districts, stuff like that, just to make sure if there is a major storm that comes through, everybody's on the same page and knows how to handle the situation. You can visit our Florida Health at Hillsborough website, and there you can register online for special needs shelters. These are shelters that we staff during storms or hurricane seasons usually, and they are set up for individuals with special needs. So those are people who are stable medically, but they have a condition that requires maybe regular observation, assessments, medications that require refrigeration. They could be on machines for oxygen. So any medical machine that requires constant electricity, these are individuals who would qualify for our special needs shelters. And you're welcome to register yourself or a family member if you qualify online. There is a procedure that they will go through to determine if you are eligible. And it's always advisable to register before hurricane season so you are on our list. And if you show up at a shelter, it's easy to check you in. All right, and then some other health education and disease programs that we have. We do monitor multiple reportable diseases through our epidemiology program. Right now, everyone knows COVID is the big thing, so our EPI team does kind of monitor those diseases, but they do other diseases like measles, mumps, when Ebola was here, when Zika was here. So they just regularly are checking for outbreaks and working on ways to prevent future outbreaks and spread throughout the community. There are training programs, like I said before, with our education programs. You can reach out to us and let us know if you're looking for a certain education program, and sometimes some of our divisions are able to accommodate and help you all. All right, here is some contact information. Our website, hillsborough.floridahealth.gov. The email, the info.hillsweb@flhealth.gov, that goes to our main management distribution list. So if you send an email there, it will get to all of our program managers, and the appropriate program will respond back to you. Our main fax line, if you need to fax anything in. And then I mentioned before, our chronic disease programs. Our getintofitnesstoday.net website has some information on our chronic disease programs with our phone number, and the 307-8071 is for our health promotion program and our community health division. So that, I think, covers most of what's at our health department.
This is the Q&A portion of our program, so feel free to, I see some questions already coming in, but feel free to post your questions there. Jennifer, thank you for sharing all that information. I do have one question. That contact information you shared up right now, just recently, is that information in any of those handouts?
It should be on the community universal brochure. Most of the information should be on there, I believe.
All right, excellent. Thank you. Okay, so we do have a question about someone's, I guess it's regarding some of the clinical services and some of the other services. Are there any special arrangements provided for people or individuals with mobility issues?
Are you talking like transportation? We don't usually provide transportation for some of those, but we can help work with individuals to see sometimes Sunshine Line and some of those. If it's a medical appointment, we'll do transportation, so we can help individuals find resources if they need assistance to get to some of our locations. And some of the programs we do, especially with our chronic disease education, we are now offering virtually. So some people won't even have to have transportation as long as they have an internet connection at home.
Sure. Yeah, that was actually another question that just came in. Are there any online options? And you just said there are, so that's great as well. Okay. You mentioned the education, some of the education programs, and someone wants to know, is there any sort of cost to any of those?
Depending what it's for, we do for corporate businesses, we have a fee of, I think, $125 for certain education programs if we're doing kind of business seminars. But for certain like health fairs and other, I know we've done some for churches and other organizations. If you're looking for like a quick lunch and learn, yeah, we don't always charge for all of those. It's kind of a case by case basis.
Okay, thank you.
Yeah.
All right, and let's see. You mentioned providing assistance to folks who don't have insurance or are underinsured. Is there a process for that? Do they need to demonstrate that they're underinsured or don't have insurance?
Yeah, there are ways. Sorry, I'm not an expert on all of those. When I was talking about that, I know I was mentioning the breast and cervical cancer program. Yeah, we do have an application process, and then we look to see if individuals have insurance or if they qualify for Medicaid or Medicare. And if they haven't applied, we do assist people in applying for some of those. But we will start the process with the screenings and stuff before all that approval's done, because we don't want there to be a wait or a delay, especially if there's a health concern that needs to be checked.
I see. All right. Any more questions from our audience? Feel free to post them here. I'll give you a little bit more time. And of course, if you don't have any questions, that's completely fine as well.
And if anybody comes up with anything after we end, they're more than welcome to email me individually or that main info, that website that I gave you, that email address. I am also on that list, so I will get all of those emails.
Great. All right. Well, I think that is it for our questions. And let me go ahead and bring up my screen now. Thank you again, Jennifer. That was a really great presentation. We're very grateful to have you and Florida Health providing the services that you do.
Thank you for inviting us.
Oh, yes. So if you'd like to contact the library, you can call the number here on the screen at 813-273-3652, or you can go online at hcplc.org/contact. Also on our website, you can find out about upcoming events at hcplc.org/events. And as Jennifer mentioned, the Florida Health at Hillsborough County website is hillsborough.floridahealth.gov. And it's in those PDF downloads that Jennifer provided. So with that, I say thank you to everyone who came and attended. Thank you, Jennifer. And I hope you all have a great evening. And we'll see you all soon. Good night, everybody. Good night, Jennifer.